right, so hello everyone. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories our work takes place. While we meet today on a virtual platform, we can take a moment to acknowledge the importance of these lands, which we each call home. So my name is Autumn Sipis. I am the project manager for the Canadian Coalition for Green Healthcare, and on behalf of the Coalition, the Canadian Association of Nurses for the Environment, and the Ontario Nurses for the Environment, I would like to welcome you to our third Nursing Week event, Healing the Planet, Nurses and Green Teams in Action. Like I said, this is our third Nursing Week event. We have two more, another tomorrow and on Friday. I'll put a link in the chat if you guys haven't had a chance to see or register for those other events. Um, the theme this year is the power of nurses to transform health, and we're really looking at that from the lens of sustainability and planetary health. So thank you all for joining us today. Throughout the event, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation, and the panelists will be answering questions at the end of the event today. This event is being recorded and it will be sent to all registrants and available on our website and YouTube channel at a later time. I will probably send out the link at the end of the week along with links for all of the other events. So you'll get a nice little package in your email. If there's an event that you wanted to go to but weren't able to, you'll get that recording on Friday. So I'll now hand things off to Maya to introduce herself and kick off the event today. Take it away, Maya.
Thank you so much, Autumn. And yes, I really just want to say thank you all for joining us this morning. My name is Maya. You may or may not know me already. I am the past president for the Canadian Association of Nurses for the Environment. I'm still switching, saying that I'm not the president anymore. We have a wonderful new president, and she's doing great, but I am past president, and I'm very fortunate to say that. It was a great experience. And we're super happy to be sharing Nurses Week and working together with the Coalition again to bring you several events every day this week. So today we're going to talk about green teams, and I am very pleased to share this wonderful moment with you with Rahel Gurmai. And Rahel is a registered nurse with Island Health, I believe. And I also have Caitlin North, and North is also a registered nurse and a PhD candidate. And they're both going to tell you about the green team work that they've been involved in. Before we get to that, though, I'm just going to share a little bit about the work that I've done on Green Team. So, I am an assistant professor at the University of Alberta, and the research that I'm interested in is about sustainability in healthcare. And I completed this work as a postdoctoral student with my supervisor, Dr. Jennifer Baumbusch, through UBC. So I'm going to just talk a little bit about what we found. It's going to be a real snapshot. It's a bigger study and there's lots to say, but I don't want to take any more time because what we really want to know are about the people who are doing the work. I'm doing the work too, but from a slightly more theoretical perspective. So anyway, without further ado, let me tell you a little bit about my study. So the work was called Examining Canadian Hospitals' Support for Planetary Health through the Implementation of Green Teams and Sustainability Offices. I know, a very snappy title. The purpose of the work was to understand how Canadian hospitals support planetary health, specifically through green teams and sustainability offices. We used interpretive description, which is a qualitative framework developed by Sally Thorne, also a nurse, and it's particularly well suited to applied critical questions. Recruitment was conducted throughout April to July 2024. The study was open to individuals employed at a Canadian hospital and were a part of a green team or a sustainability office, or both turned out. So at first, eligible participants were sent a survey that screened them further just to make sure that they were in fact eligible. We collected some demographics, we asked some preliminary questions, and then at the end, participants were asked if they would like to participate further in some semi-structured interviews. Between April and July of that year, 43 people filled out the online survey, and the final interview participants ended up being 29. So we had 29 interviews, and that was across the provinces from British Columbia to Nova Scotia, which provided broad national representation. We did not get anyone from the north. We're going to move on to the findings. Again, this is like a real snapshot of this study. If you do want to know more and you want to hear about more details, I did a larger presentation on this work for the coalition's Green Team Hub that they are hosting, and I'm a co-host of. And yeah, if you want to learn more, you're welcome to watch the recording of that. It's on their YouTube channel, and I think Autumn will share the link at some point. So anyway, the findings from this work, again, kind of high level. The core argument from this study is an integration argument. The combination of sustainability offices and green teams connected by engaged leadership, that was the most effective configuration for planetary health in Canadian hospitals. So, first, they have a complementary scope. Sustainability offices and green teams were designed to do different things. Sustainability offices address macro level infrastructure driven emissions. Green teams address clinical culture, waste, food systems, and patient engagement. Neither alone is sufficient for a comprehensive planetary health promotion. You really do need both, coming from the top down where the sustainability offices are and the bottom up where the green team work is done for that high level change to happen. One without the other does leave significant planetary health territory unaddressed. The second big finding is the greenhouse gas trap. A common organizational tendency is to reduce sustainability to just greenhouse gas emissions. We know, obviously, greenhouse gases are super important, and we're not overlooking that. It just felt a little narrow. Planetary health encompasses biodiversity, water, soil pollution, and justice. Green teams, with their clinical and community facing orientation, nationally widen this lens. Focusing exclusively on greenhouse gas reductions, while again, super essential, I'm not undercutting this or underselling it, it just obscures the broader planetary health specific agenda. Green teams, when well supported, naturally expand into biodiversity, resource stewardship, and climate justice, dimensions sustainability offices don't often look at. Finally, the last kind of takeaway here is that leadership is so important. The data are clear that when leaders are genuinely connected to green teams and not just nominally supporting them from a distance, the reach and impact of those teams grows substantially. Visionary organizational leaders are the essential connective tissue. When leaders participate in green teams and actively bridge top down and bottom up processes, teams can target larger scale, more impactful initiatives and sustain momentum over time. This is a direct call to action for the leaders in this call right now. You have to be there and you have to be on the front lines with your green team folks if you want to see them succeed. So, in summary, hospitals with both a sustainability office and a green team that work collaboratively, supported by visionary leadership, are best positioned to become significant planetary health leaders. And the two speakers that are about to share their experiences with you today are going to be able to tell you a little bit more about what these types of teams look like in action. So like I said, there are a lot more details to this study. Those are kind of the three main takeaways in a snapshot, in a nutshell. And I am extremely pleased now to pass the mic over to my colleague and friend, Katie. So please go ahead and take it away, Katie.
Great. Thank you so much. And thank you for sharing your experiences with your study, Maya. That's very interesting for all of us who are interested in green healthcare. Um, yeah, so welcome everyone. I'm very happy to be here today and tell you about my experience with the development of a green team within a tertiary care site here in Canada. I want to highlight for all of you today what the process of developing a green team looks like, and give you some pointers on what you can do as nurses to launch your own green team. And then also share some of the accomplishments from the team that we have established here in Winnipeg at St. Boniface General Hospital, which is where I am located. Sorry about that. I started on the wrong slide. So I'll not explain to you all in great detail what the planetary health and climate crisis is, because I'm sure everyone who is attending this event is already well versed and informed on the global climate crisis. But I do want to impress upon you that the healthcare sector um, has environmentally harmful practices that are still in place right now, and the healthcare sector itself is a significant contributor to the global climate crisis. We recognize that healthcare is responsible for approximately 5% of the total global carbon emissions, as well as is a contributor to pollution in air, soil, and water supplies. And that is just due to the general infrastructure and processes required to run a healthcare facility. So all of this background information that I'm briefly sharing with you is the starting point for the development of your green team within healthcare. Understanding these root causes and the connection between planetary health and human health is a foundation for anyone looking to champion a green team. So I would suggest to all of you to do some reading, get this background knowledge, and have a strong foundation understanding the root causes of the global climate crisis, how it relates to healthcare. Um, so environmental sustainability is another important topic that you'll need to be well informed on in order to launch your own green team. And environmental sustainability refers to the responsible use and balanced use of our natural resources to meet the needs of our population without adversely compromising the ability of future generations to meet their own needs. So it's about maintaining an ecological balance in our planet's natural environment and conserving natural resources to support the well-being of current and future generations. If you're looking to develop a green team, proposing high level goals, such as making your organization more environmentally sustainable, is a great starting point to give your organization a focus and a long-term objective. To achieve environmental sustainability, organizations can take several steps. So looking at reducing overall carbon emissions. As Maya mentioned, carbon emissions we know are a huge contributor to the global climate crisis. So adopting different renewable energy sources and promoting climate action that can reduce carbon emissions from a specific site are a great targeted approach that an organization can take in conjunction with the development of a green team to promote sustainability. Conserving water. So learning to avoid water waste is really crucial, as we have already seen 2.2 billion people on the planet lack access to safe water globally. And this is a huge factor for safe consumption of water and to avoid additional pollution. Promoting sustainable development within your site. So incorporating sustainable development into institutions and promoting eco-friendly practices can make a big difference, especially in the long term when we are talking about adjusting our policies and practices to reflect sustainability. Also, implementing recycling and other waste reduction initiatives. So, this can be as simple as increasing paper recycling, plastic, glass, and aluminum in forms of packaging that we see within healthcare facilities, or a more tailored approach to reducing healthcare generated waste specific to your site or specific to an individual department. These are all very high level goals that an organization can set and slowly work towards with a green team. And we've seen some success already within different tertiary care facilities in Canada who have set these types of objectives. So when developing a green team, the process is going to slightly vary depending on the facility and the health region that you're located in. But you can loosely follow some steps to develop your own green team within a tertiary care site here in North America and in Canada more specifically. I would suggest start by developing your vision for the green team. What is it that you want to accomplish? So, some of those high level goals that I just discussed in terms of environmental sustainability, have a few ideas in mind of what you would like to see long term. And then also have a couple of ideas related to our low-hanging fruit. So the low-hanging fruit, those are project options that you can prioritize within your site and that are easy to achieve. Often these projects do not require a large financial investment or have minimal effort for the operational needs of the site and would likely be supported by the executive in order for you to achieve some of these projects and get the ball rolling on your green team. If you can have these high level goals and some low hanging fruit projects in mind when you approach your hospital executive with the idea to launch a green team, you are much more likely to be successful in getting approvals that are required to develop this team and committee and then get some of those projects off the ground. Whereas if you're only coming with high level overview or projects that cost a lot upfront, you might face some barriers. So the second step to developing your green team, it may seem a little bit daunting, but you'll need to approach the executive team and your site in order to secure their support to formally launch a committee. Most organizations in Canada are based on a hierarchy structure, so you'll need to secure an executive sponsor. If you can find someone within your hospital executive who is also passionate about the environment, even if their role within the executive is not related to sustainability or related to nursing practice, they can be, for example, my executive sponsor is our communication director within the site. So anybody on the executive who might have a passion for environmental sustainability, you want that person in your corner. So learning who is your executive team, what the hierarchy is within your facility, and then networking to create those connections and develop that relationship is going to be integral to getting your team launched. You want someone who is in your corner, who knows the processes and can connect you to the executive or to the board of directors in order to get that buy-in and launch your green team. Thirdly, once you have your person and you know who you need to connect with and you've developed that personal connection with the executive, you're going to want to create a formal request for a committee. So the process may vary from site to site as to how you go about getting these approvals, but it's really important that you have a written formal process for what you would like to include, what your goal and objective would be for your green team, how many participants you envision having on your team, if you're going to have a co-chair, things like that really need to be laid out and clearly identified so that you can present it to the executive team and get that formal approval. Formal approvals can be especially important if you are looking to develop something like a cost center so that your team has an operating budget, because that would require additional steps within the executive, and potentially they would need to return to the board in order to get those approvals, or even more broadly to the health region in order to secure funding. So this is a step that you cannot skip, and it might be a little bit daunting or boring to write all of this out, but it's really important that you have a clear plan outlined, identifying even the most minute details, who you anticipate will be a member on your team. Once you have the formal approvals and the executive is behind you and you're ready to launch your team, you're going to want to send a call out for membership. So in my case, having the communications director on my team as our executive person was very helpful because he was able to step in and say, this is how we can reach the most people within the organization to put a call out for members and was able to send out memos and different um, email membership recruitments. So try and develop a diverse team. You'll want to recruit people from various departments, roles, and backgrounds within the organization. You'll want people from engineering, people from frontline care, people in executive, administrative positions, waste management, kitchen, etc. So that you have a diversified group with a lot of different perspectives and expertise. And that's really going to help you round out your team and be able to pull from everybody's different knowledge bases. And that networking is extremely important. Once you have a strong membership and you've had your first meeting where you develop different roles and objectives for the team, and maybe some ideas of the first couple of projects that you would like to launch. So those low-hanging fruit projects that I mentioned earlier, you'll want to secure a funding source. I know that can be a significant barrier in tertiary care in Canada because funding is often very tight. But if you can find an external source or do a form of fundraising or get a donation or grant to launch even a small project, this is going to be huge. And you can show the executive the wins that you have had using those funds to help you secure future funds for additional projects. There are lots of non-for-profit environmental groups, as we're seeing here with Nurses Week, and you can reach out to them as resources to help you find different types of funding to launch these projects within your site. Initiate some meetings. So make sure that you're having regular meetings with your team. I would say monthly is a must do, and do some brainstorming. Learn and lean on the team members and recognize their distinct areas of expertise, the people they may know within the site or within the health region or even just within the local community. And this networking can be extremely helpful for addressing problems and projects within the site that you want to approach in order to better and make more environmentally friendly. And another item that is very important is maintaining visibility within the organization. A lot of these steps that I'm highlighting are things that are going to happen in the background. And it's difficult to keep the momentum going when the site itself doesn't recognize all of the things you've been doing in the background. So try to maintain a visibility and presence within your site. Do quarterly updates, send out memos, get in on meetings with the executive or with the hospital board and demonstrate your wins, no matter how small they might seem. Presenting that information to the executive to maintain the interest and engagement of your team is going to be essential to garner future interest and investment in your green team in the site. And it's very easy to just do all of this in the background and be humble about it, but you want to maintain that presence in order to continue receiving that support from the organization. I've just highlighted here, and I believe it's going to be put in the chat as well, the link to the nursing toolkit for planetary health. There are some steps highlighted within that toolkit in regards to developing your green team that you can refer back to after this presentation. And it was a great resource that I was fortunate enough to co-author. And if you are looking for tips or tricks going forward as you develop your team after this presentation, please check out this link here for the toolkit for planetary health. Very briefly, I want to highlight some of the successes that I've had with my green team at St. Boniface General Hospital. So I followed all of these steps that I've just highlighted for you and successfully developed the Environmental Sustainability Committee for the site back in 2024. I approached the executive and had them adopt into the strategic priorities environmental sustainability. So once that was formally entered in the site's strategic priorities, the executive was a lot more supportive about moving forward with the development of the committee. And I was able to get an executive representative who is the site's communications officer and a co-chair who is a director for property management to help me put together this green team. We have people from all over the site, different areas and different professional backgrounds who collaborate on projects. We identified some areas of improvement and have overseen a few different green projects, grant writing, research, as well as promotion for planetary health and physical health and wellness for the staff at the site, because those are correlated. Some of these successful projects that we have done include removing the anesthetic gases, wellness activities, Earth Day celebrations and promotions, as well as expanding our on-site gardens and monitoring some metrics and working with other organizations who support green teams. Removing the anesthetic gases was a huge win for our site, and it was actually one of the low-hanging fruit projects that we identified early on that would not cost our site a lot of money upfront and actually generated a significant cost savings to our site. This was targeted as a project because there was the Nix the Nitrous campaign that the coalition was promoting, but also the significant amount of data that was being produced from studies showing the amount of leakage of anesthetic gases. So specifically, we removed the desflurane from our site at St. Boniface General Hospital, and we have switched to Sevo. So you can see the drastic difference between the CO2 emissions from the blue line at the bottom, the deso, to the yellow that we're now using, which is sevoflurane. And we have to date been able to divert over 1 million CO2 kilogram equivalents now from St. Boniface Hospital, and we are generating over $180,000 annually in cost savings for the organization. So sharing those wins with the executive is huge because we can take that cost savings and now use some of it to fund future green projects within the site. Planetary health and wellness events. We promote a lot of events for our staff, like get outside, be physically active, find alternate modes of transportation, and we collaborate with other committees within the site, like our wellness coordination team, in order to promote community wellness for all of our employees here at St. Boniface Hospital. And this has been quite successful in terms of reducing litter and reducing CO2 emissions for transportation to and from work. These are just some of the posters that our committee has developed that we launch regularly as reminders to the staff and to keep people informed about what can be recycled, reminders to not litter, celebrations for Earth Day, things like that. We also have an on-site garden at the hospital that we have expanded significantly through collaboration with some partnering organizations. We've developed an annual vegetable garden, and we are adding a pollinator garden this year to attract butterflies and bees, and then build on that community involvement as well for our participants and get some physical activity outside. Our composting project as well, we now compost all the food scraps off of the patient trays and from the food prep areas in our kitchens within our site. So we've successfully diverted over 80,000 kilograms of food from the landfill to a compost within the city of Winnipeg. This additionally causes a little bit of cost savings for the site as we're not sending as many kilos to the landfill, and we're able to reabsorb some of those costs to continue funding future projects. And this is a snapshot of the CO2 and the water diversion that we have subsequently created by doing the composting of our food within the hospital. So those are just some of the successes that we've had in following the steps that I've shared in developing a green team. It does take quite a bit of time. As you've seen, I started this process back in 2023, and we are just seeing the fruits of these labors now in 2026. So I just want to share with you all not to get discouraged. It is a process, and I wish you all the best with your own green teams. Thank you.
Great. Thank you so much, Katie. Really appreciate that. I love that you have kind of like a step-by-step breakdown for people. That's like through my work, one of the things that I had found is that people don't really feel like there is a lot of guidance, and a lot of people are sort of doing it on the fly. And so it is nice to have something concrete to hold on to. And Yeah, I think that's really great. It's also wonderful to see the work that you're doing. I think another interesting thing that came out of my work is that, green teams come in various shapes and sizes and forms and all of that. And so I'm excited for our next speaker, Rahel, to take the wheel and show us what her green team looks like. So Rahel, if you would like to take it away, by all means. And I see there are some questions coming in. We will get to them at the end, but keep bringing them in, guys. We're gonna talk about it all, and yeah, Rahel, please, thank you.
Thanks, Maya. I'm just going to share my screen. Can you guys see it?
I see your slides, but it's not in presentation mode.
Okay. Hmm. 1 second.
Yeah, I remember F5, if you want to do it quickly, if it's not going to mess up your notes or anything.
Yeah. Let's see. So that. Hmm. Oh, technical difficulties.
All good.
Let me just. I'm not sure that one.
I can offer to share your slides for you as plan B.
Yeah. Okay, let's give it one more time. That doesn't work.
Maybe in the meantime, Katie, just really
Yeah.
quickly, you got a quick question. What is the Jack Frost challenge? Do you want to just answer that quick?
Yeah, so that's something that we do locally in Winnipeg every year in the month of February, where we encourage people to find alternate ways to get to work and use non-carbon emitting modes of transportation. So the St. Boniface Hospital is right next to the Red River. We have the Long River Trail, and we encourage people to skate to work, to snowshoe, to walk. Although it can be a bit of a hard sell in Winnipeg in February to get people to go outside. There's also a team challenge where you can log the amount of kilometers of physical activity you're doing outside in the wintertime. And it's just a way to promote both healthy living and low carbon approaches to transportation. We do one in the springtime as well, the commuter challenge, which is the same idea, but in the summer.
Awesome. Thanks, Katie. There is another question, but I think that'll be good for the end, but we'll go there. Rahel, how are you making out?
I think maybe if Autumn could just share her
Wonderful.
screen,
Yeah,
it's just
Autumn.
not working for some reason.
That's technical issues. They only happen when you really need it to work.
Ah,
Okay, Rahel, I can see your
thank
slides. I
you.
believe that's Autumn. So you just let Autumn know when you need to advance the slides.
Okay, great. Thank you. So, yeah, my name is Rahel, as Maya has introduced, and I am part of the Green Team at Victoria Hospice. Um, I thought we would start with something really intense, which is the accreditation process, because that's something that we've been working on. And then I can briefly talk about our initiatives at Victoria Hospice and in collaboration with Highland Health, and some ideas on steps to take on for your climate action project. So if you want to move on to the next slide. So section 2.7 in the Health Standards Organization Leadership Standard on Sustainability creates a clear bridge between organizational leadership and environmental stewardship. This connection lies in how leadership is expected to integrate environmental responsibilities into decision making. operations and long-term planning rather than treating it as a separate initiative. So in doing so, this criteria provides an opportunity to promote environmental best practices, support the inclusion of environmental and climate-related actions in organizational planning, as well as encourage leadership to advance initiatives that strengthen environmental stewardship. So things we will be thinking about is, are we considering environmental sustainability in our organizational, departmental, unit-specific goals or services? Are we developing and updating these policies to reflect this? How are we implementing environmental stewardship initiatives? Are we leveraging performance indicators? And how are we evaluating climate change impacts on the organization and the health of the community? So if you go on to the next slide, what this looks like in practice, I thought I could share 4 examples of how we meet the set of criteria at Victoria Hospice. So for one of these sections, 2.72, basically looking at the policies, we have been regularly updating our related policies and strategic plan to reflect a strategic goal in terms of environmental health and planetary health. So creating documents like our Feuille de Route 2025 to 2030, which is a strategic roadmap, as well as providing annual climate change related reports to our staff so that they are involved and can contribute or provide ideas, as well as have updates on what our organization is doing. 2.7.3 talks about implementing environmental stewardship initiatives. And we practice this through things like our waste management initiatives and other initiatives that I'll talk about in the upcoming slides. 2.74, leveraging performance indicators. So we have a biannual impact report that our team tracks measurable indicators, such as things related to our waste diversion initiatives through recycling and composting, adoption of reusable clinical supplies and things like that. These indicators help us understand trends, demonstrate progress, and identify where further improvements are needed. And then for 2.76, building organizational capacity. We do that by educating staff, and the green team itself is a way to leverage this as well. How we all got started is participating in the Island Health Green Team cohort and using those resources and mentorship to be able to drive the changes that we are implementing at this moment. This also provides staff education on planetary health, as well as knowledge sharing activities, such as conference presentations, not only within our organization, but across the country, and so on and so forth. Next slide, please. So one of the initiatives we adopted last year is the Sustainable Commute Participation initiative. So in British Columbia, approximately 40% of our annual carbon emissions stem from transportation. So encouraging sustainable commuting not only mitigates a percentage of these emissions, but it also promotes significant health benefits. Fortunately, we can decrease these emissions locally by choosing public transit or active modes of transportation like walking or cycling. So for Victoria Hospice staff in the last 6 months, we have a graph that highlights some of the tracking that we've done. So as you can see at the graphs on your left, there's an illustration of how this measurable impact of our team has made through sustainable commuting. Over the last 6 to 7 months, staff logged more than 2,600 kilometers of active or low emission travel, 91% of which came from walking and cycling. And by choosing these options, we prevented approximately 654 kilograms of carbon dioxide equivalent emissions. And this value is excluding public transit and carpooling, but We're starting somewhere. There's a few of our staff that has started, and we're hoping to build this so that people can see the significant impact of just walking or cycling can do. Um, and if you want to look at the statement at the bottom there, the equivalency so far of like what we've been tracking is about 2.5 months of taking your car off the road, which I think is really important. And then from like a personal savings perspective, in terms of gas prices right now, I think that's an added bonus. Yeah. So next slide, please. So other initiatives, brief snapshot of what we've been doing here at Victoria Hospice. So rather than focusing on a single project, and I mean, we've been doing this for the past 4 years, is really working through what sustainability means for our organization, for our clinical practice, and our everyday work habits. And so what's really important to emphasize is that these initiatives, like I said, didn't happen all at once. We started with the reusable gowns and reusable tumblers, and by reaching out to our colleagues and other green teams, we're able to implement other things that we were able to do not only within our organization, but practices that we also do at home. That kind of like transcend our, can be done not only in our professional but in our personal lives. So at the foundation of our green team, like I mentioned, Feuille de Route 2025 to 2030, it provides strategic direction and helps align individual initiatives with long-term goals. So for our sustainable commute program, for example, that's one thing that we're hoping to collaborate more so not only within our organization, but with other pilot projects across Island Health as well. We also have composting and recycling initiatives, including milk and juice containers and soft plastics, which when we are collaborating with community centers, there is some money that comes back. So we are collecting that money and we're trying to build that back into the green team and initiatives that that we're potentially maybe looking ahead to start. And then the reusable gowns and tumblers. That's an initiative that we had initially started, and our recent metrics show that specifically even with the reusable tumblers and saving plastic, we've decreased our costs for purchasing plastic cups and containers by about 46%. So yeah, highlighting Second Life supplies. So this is a key part of making work sustainable that includes engaging community partners and building strong relationships. So by being able to donate some of these supplies that we have instead of them going to waste, donating them to trusted partners within community health agencies has really built that additional collaborative approach towards environmental sustainability. Next slide, please. So I talk about Victoria Hospice Green Team almost like a kind of separate quote unquote entity than Island Health, because when we initially started, we did start as a green team under Island Health, and that was because we had a shared goal within each of the organization's strategic plan for environmental sustainability and planetary health. And so it provided us the opportunity to receive support from our local health authority to be able to build and grow our green team. Today, this program within Island Health supports 14 other green teams across healthcare sites on Vancouver Island and over 40 unique sustainability improvement projects to reduce waste and improve water and energy efficiency. So we've adopted some programs that Island Health had supported us with in the beginning. So things like e-learning from, their resources, paid time for clinic staff for when they need to work on green team meetings and associated things outside of their normal shift, things like project guides and handbooks. And there's still this collaboration that we have that's ongoing. From a systems perspective, even though, the green teams, like I mentioned, work in different areas across the organization, including ourselves, it provides a community of peers that not only share tools and resources, but also an opportunity to learn from each other's experiences, adopt proven practices, and avoid duplicating efforts. So, we believe that this connection helps scale local initiatives and keep our work aligned with system-wide priorities. Next slide, please. So some simple and practical steps in taking for your first climate action. One powerful framework we've used is Dr. Ayanna Elizabeth Johnson's climate action Venn diagram. This idea is to focus on actions that sit at the intersection of engaging in activities that resonate with your interests and your strengths, reflect on how your unique skills can contribute to environmental sustainability, and identifying actions that not only address pressing issues, but also bring you satisfaction and fulfillment. When those three areas overlap, climate action feels more meaningful instead of feeling, burdensome, and that's where people tend to stay engaged. So if you're thinking about taking your first step, either as an individual, as a team, as a leader, here are a few steps that we considered and have kind of like, to the best of my knowledge, we've almost perfected in a way as we've carried out these different initiatives. So first is identifying key focus areas in your work or your unit. What environmental issues feel most relevant or motivating? And then you want to prioritize actions based on what's realistic with the time and the resources that you have. Stating clear, measurable goals so you can actually see progress. Engaging partners across roles. So that could be, like for our team, we have nurses, we have physicians, we have admin, we have environmental services, we have leadership involved as well, because we need those diverse perspectives to be able to move forward some of these initiatives. Then you monitor progress and you adapt as needed. This is an ongoing process. And last but not least, celebrate your wins. Share your successes in short huddles, in webinars and conferences and collaboratives, because this motivates the team. It keeps people engaged and encourages staff ownership of ideas coming to fruition, and it's a source of inspiration. So I really want to highlight again that like taking these steps, they don't have to be overwhelming. Small collective steps always add up, and anyone and everyone can participate in a meaningful way. Next slide, please. And from a nursing perspective, as one of the largest healthcare workforces, nurses are frontline observers of waste and inefficiencies. We influence workplace culture. We advocate for patient and community health. We are translators of health information and have influential roles embedded across many organizations and various industries. So a focus on environmental health and sustainability is essentially a natural extension of that innate leadership that is part of our daily practice. Next slide, please. So in terms of what we can do, here are a few things that we personally have kind of reflected on as a team. And I just kind of want to leave you guys with we have, as nurses, we have the credibility, we have the leadership skills, and we have the collaborative reach to drive environmental sustainability in healthcare. The work we have accomplished this far has shown me that when we lead collective efforts, like I said, small changes can produce measurable impacts for both human and planetary health. So we should not only participate in sustainability efforts, but serve as catalysts for change. Thank you.
Thank you so much, Rahel. That was wonderful. It's so great to see how much you guys are doing. I think you make such good points about, making sure we're talking about successes and making sure that we continue to inspire. This is a field that's really easy to get demotivated in. We hear a lot about all the horrible things happening, and there's so much good work happening on the ground, which I think is also why green teams are so appealing to so many people. But it doesn't get talked about. So thank you so much. And Katie, if you don't mind, I'll get you to turn your camera on. We have a little bit of time for questions. And so the first question that came in, and certainly whoever wants to take it can, is about virtual nursing. What are the principles that we could apply for virtual nursing teams? If either of you have any thoughts, you're welcome to just kind of speak, and if not, I can take it.
I think that the principles, like the steps that I outlined to developing a green team, can still be relevant for virtual nursing, even though you might not have a facility or home base that's producing a lot of physical waste. There's always room for improvement to become more sustainable. So maybe just tailoring the objectives to the work that you do, to your home environment or your office space, and coordinate with the other members of your team and the hierarchy within your group. I think that could still all be tailored and applied to that type of nursing. It's really just about finding what fits for your team, and going up through the hierarchy within your organization and your virtual team in order to get some policies and protocols put in place for future sustainability. So I think you could still use some of the resources we put forward today and tailor it to your needs.
Thanks, Katie. So I think I'd like both of you to answer this next question. Rahel, maybe you can take a first crack at it. But the question is, I'm not sure what your positions are at these institutions, but how do you balance your primary role and then leading the green teams? So Rahel, why don't you go, and then Katie, you go.
Um, it ca- I think initially it was a bit difficult, but honestly, like I think part of it is the drive and like I said, the motivation of seeing what the impacts that you have from the actions that you're doing. Um, there's a balance. Like for my team specifically, we do have car coverage sometimes, and there is like I mentioned, some monetary compensation for the time, so it doesn't feel like you're using work hours to not having work out. Always trust me, see this compensation so that I don't feel like I'm um taking away from work hours to do the work that I have. So I think myself and Dominique have been really lucky in that way. But it's something that we're also passionate about, and I think that's another thing as well. So in terms of balance, as nurses, I've kind of worked across the board. I've worked bedside, I've worked in leadership, I've worked in practice. I think to be truly realistic, I don't think like balance is the right word, but I think that if you're motivated and you see the change and you feel that impact, I think then it's more so like a give and take that way. I hope that is helpful. I hope that answered your question.
Thanks, Rahel. All right, Katie, what's your answer to finding balance?
Yeah, unfortunately, my role is more administrative. I manage an inpatient unit for acute care medicine. So that is time consuming in and of itself. And the role of environmental sustainability team coordinator and chair is off the side of my desk. So there is no specific position within my site, or within my health authority for environmental nursing. But that is something that I have been working on. I've been in discussions with the executive team and then with the broader health region to try and develop positions. So the hospital is open to it, and I'm hoping to see, even if I don't get that role, somebody placed in that type of a position so they can coordinate all of these things. I think for me, because my PhD is related to this area and I'm on a number of committees, I have that background knowledge. So it maybe comes a little bit easier and quicker to me off the side of my desk. Whereas if someone was going from zero background in this area, it might be a little bit more challenging just to find the time in order to develop some of these projects. But certainly the people who are a member of the committee are motivated to want to contribute. And I can see that too in my research with the site that a lot of people want to do the right thing and make these changes. It's just a matter of kind of squeezing it into your day to day. And it does require, unfortunately, a lot of work on my own time, in the evenings at home, in order to get projects established and things like that. But I find it worthwhile and fulfilling, so I don't mind putting in my own time off the clock, in order to get the ball rolling on some of these projects.
Thanks, Katie. And I'll just add that from my work and talking to people, that was a very big theme that came out is that this was often side of the desk work. And one of the, things that I would respond to that as well is like, this is kind of the amazing thing about nurses. They're so committed to their patients, they're committed to the environment, and making the world a better place, but it should be paid work. And that's sort of, I think, like green teams as a concept, it's not fully there yet. And I think the next question actually ties into this because Rahel, it is paid work with you, at least some compensation is present. So I'll read this next question in a minute after I get off my soapbox that green team work, while we do it because we're committed and it's important to us and it gives us meaning and it's fulfilling. I hope to see a day where where green team work is also paid. It's I think that is sort of the hope, that getting them really embedded in the hospitals and seeing them be sort of just like a part of every hospital and healthcare setting. That is the dream, the goal, right? And that it's properly compensated, because it needs to be. We need it. Our planet needs it. So anyway, I'll go to the last question here, before we wrap up. Rahel, fantastic examples of Green Team in action. I was wondering if you have more information related on how staff get their time paid to participate in the program. Is the funding coming from a green fund or individual operational budgets from Island Health, or is it sponsored by other means?
So there is operational funding from Island Health to get that covered, and I can share if you guys want more information, more detailed information. Definitely reach out, and I can go through like the numbers and how things get covered. But yeah, from a health authority perspective, like I said, it's part of Island Health's strategic plan, and so green teams, there's a coordinator that manages or supports all these green teams, and so there is time that's compensated for this. It's not 100%, but there is compensation for that. And like to your point, Maya, like what I have seen in the last like couple years for sure is the more green teams that start get created within our own health authority, like even the groundwork, because all of us have done some sort of like initiative here and there. The groundwork of starting from like point zero is not really there because we connect within the different cohorts and we're able to like support each other. And so that also in terms of like saving time and effort and some dollars is very evident. So feeling very lucky that our health authority is sticking to that for now.
That's wonderful. Okay, well,
Yeah.
with the last 30 seconds left, Rahel, Caitlin, thank you so much for your time. I so appreciate hearing about the groundwork you both are involved in. I hope you all enjoyed your time with us today. Happy Nurses Week, and to all the nurses out there, we see you, we love you, we appreciate you, and one week is not enough to really celebrate the work that nurses do. So, with that, I hope you all have a wonderful rest of your week. Please continue joining us Thursday, Friday. We still have more to go, baby. All right. Have a wonderful day.